going to have lunch ultimately. If you do want to have some questions, let me just say it. Yes?
I thought that you were asking who wants to
So let me just say a few things and then let's go to the discussion. We've heard all morning the discussion of these important issues. I just wanted to point out to you what a big deal it is that we're discussing these issues. Let me tell you a little bit about my personal history. In 1957, I began a PhD program in medical sociology. It was the first program in the world ever to bring together medicine and sociology. And my professor then used a word that hardly any of us understood or ever talked about. In fact, we laughed at it. He used a word called social class. Social class. There are no social classes in America. I'm serious. That really was the view. These were all doctoral students. None of us took this seriously. In fact, my professor became famous because he had just written a book showing, it was called Elmstown's Youth. It was about dating of adolescents in Muncie, Indiana. And he pointed out that boys and girls, men and women, dated each other depending on the social class they were in. Whoa. That was a major blockbuster. He became notorious everywhere. It was really amazing. So that was how it all began. I learned later, of course, that he was absolutely right. But at that time, that was 1957. This was a foreign language. In 1959, I finished my training and I was invited to give a paper on social factors and heart disease at the national meeting of the American Heart Association in Miami, Florida. I think social factors and heart disease had never really been studied together. So, as a very, very young, first paper I ever gave in my life, I gave this paper in Miami to a very distinguished group of heart people, and I thought it went well. When I left the room, the director of the Framingham Heart Study, for those of you who don't know, one of the most important heart disease studies ever done, got me against the wall and said that was a terrible thing to do. Don't do that again. All you've done is distract people from the important issues of cholesterol, blood pressure, and smoking, talking about some silly things about social factors. Stop it. So that was 1957. In 1966, a colleague and I were beginning to realize that there was a movement on social determinants. And we decided to hold a national meeting of the people involved in the work. Got the government to give us a grant so we could travel all the people to a meeting in Phoenix, Arizona. We scoured the country looking for people who would be interested in this thing, and we found 28 people. So that was, I want to just give you a sense of the way it was in those days. Today, we talk about social determinants in every school of public health in the country and many other places. There are now several really good textbooks on social determinants. So it's a phenomenon now. I just wanted to point out that in 50 years, things moved from zero to where we are today. And the way I listen to all this discussion today, this is the beginning of the next 50 years. And I'm very optimistic, not pessimistic in spite of everything. So with that, let's open the floor to answer questions and comments.
Thank you. Sorry for my early excitement. That was a very productive panel for me. I really enjoyed it, so I thank you to all the speakers. I'm a physician from Turkey, and currently I'm a PhD student in the University of South Carolina in public health school. And I had a question I wanted to take your ideas about something related to WHO's work and the ways in which WHO's agenda is being established. So there is a concern that I also share that the last few decades, WHO's collaborations, alliances with for-profit groups has been increasing, and the question is how this may shape the agenda of WHO, especially considering the representing the needs of third world countries and the most disadvantaged So I wanted to take your ideas on this issue. Thank you.
Thank you very much for that very interesting question. It is indeed a question that we are grappling with right at this moment.
I'm not sure everyone heard. Could you repeat the question, Ms.?
So the question from the floor was our response to WHO's increasing collaboration with the private sector, for-profit sector, and any thoughts on that?
Yeah, exactly. Such as transnational pharmaceutical corporations and so on.
Such as the transnational corporation and so on. Very, very interesting question. It's a little sensitive question, and it's something we are grappling with right at this moment. There's a lot of discussion about it. We have just had a new regional director at the Pan American Health Organization for the regional office. And it was indeed something that came up in recent discussions with staff. What is our stand on closer collaboration with the private sector? The stand that we have at this point in time is that we will work with some parts of the food industry. We will not work with the tobacco industry. And that is very, very clear. But how that will shape the future, it's a good question. There is a need for collaboration across the board. Some will argue that the private sector, they have a role to play. Some will argue that we are about health and we should not by any means have any dialogue with the private sector. I think the take now is that this is something that is unavoidable. We have to set certain criteria in terms of who we work with and who we don't work with. I wish I could be more comprehensive, but as I said, it's a sensitive question that's very much under review at the moment. I'm wondering if my colleague here wants to comment on that as well.
Sure. As someone who's not currently employed by the UN, I will say that this has been a growing problem in UN organizations across the board, right? This problem of the public interest and the role of public institutions. Let me give you an example, just a very quick example that illustrates the problem. Nestle in the 1990s was selected to be an expert member of a nutrition board within WHO. If you know the history of Nestle, you understand why this is essentially problematic. There's lots of documentation about aggressive push of, for instance, baby formula in other countries as a replacement for breast milk and the public health consequences of that. Okay, so it was broadly recognized as a problem. One of the things that WHO did was historically it didn't recognize civil society organizations as representatives of public meetings. They began to do this in the early 2000s, and one of the results was that you got these kind of shadow civil society organizations that were pretending like they were public interest groups, but they were actually industry kind of mass. And so then they began to talk about this distinction between PINGOs, public interest NGOs, non-governmental organizations, and BINGOs, business interest non-governmental organizations. And so that's kind of my understanding of where the conversation is now, that there needs to be a distinction between these kind of groups, and that if we make it more transparent, then we're at least going in the right direction. But I think that the problem is here to stay. I think that the challenge of how do you, fairly attend to the challenge of public-private partnership engagement, because this is very much the buzzword these days, without compromising the public interest of these kinds of organizations is very tricky. There are some groups like WHO Watch that try to highlight this kind of problem, but really as a UN organization, the push has to come from member states. And the United States has a tremendous amount of influence and also happens to be the base of many of these countries, and so there's a little bit of tension there.
Other questions?
Can I ask a follow-up question?
We're really running short of time. I'd like to get as many people involved as I can, please.
My name is Gavin, and I just want, is it Fully Love?
Yeah.
I love your presentation. I loved everybody's presentation, but your presentation is so close to my heart. Yes, healthcare reform is in the process. But what I want to know is, and I'm a nurse, not just treating those epidemics when they occur, how can we or what can we do right now? It's one thing to talk about it in the room, and I'm a little younger than you, but there used to be, back in the day, where someone was always in the community, you know, fighting and pushing issues. And I don't see that now. And so I would like to know, because, you know, drugs, HIV, everything you spoke about is not going away. And rather than waiting for, you know, everyone to have access to health care, how can we stop this now? How can we get it out there, especially to the young people?
In a slide that I didn't show, I point out that increasingly there are organizations of men who have come back from prison who are now really engaged in the process of what do we do to correct the problems that we created by the misspent youth that got us set up in the first place. I know that Texas is like New York, having large numbers of these community-based organizations, men who've done with parole, who are very interested in public service, and who are often attaching themselves to churches. Many of you are from congregations where at least one of the ministers or somebody who got religion while he was on the inside. You'd be surprised with so many of us who have had this as part of our past, how many folk are embracing it, recognizing it, and are trying to organize to do something to make things better. Identifying these folks, figuring out how we can create the coalitions that will really work effectively to move against some of the problems that you cited. I think that's an idea whose time has come, and I think that's the future agenda for a lot of us who work in these communities and are really concerned about the directions that they're taking.
Thank you.
Thank you very much for this opportunity. My question also has to do with what the last speaker spoke about, HIV in the Black community. And my question is about what is being done in relation to stigma, because we know that that is a social factor that is influencing the HIV rates. So stigma among those who live with HIV, and also stigma among those who work with people who live with HIV. Thank you.
The short answer is the Black church. It is the source of many of the problems, and I think it's the one place where you have a chance to create solutions. The New York State Department of Health has something called the AIDS Institute, and it has had a faith-based initiative that I've been a part of. I go to Black and Latino churches all over the state of New York, and I talk to congregations and encourage you about the role that their silence has played in creating the stigma that you described and advancing the epidemic by making it so problematic for folk to have open conversations about what do we do about this epidemic. And if they don't change the way in which their discourse is creating this problem, it's going to be with us. So all the things that I think that can be done easily, identifying the church as both the problem and the potential solution, and figuring out how we bring many of these often very regressive congregations back into the fold where they're talking about public health in ways that make sense. Until we're able to do that, I think we're going to have that problem persist. I was part of the civil rights movement in the 1960s. From 1964 to 1966, I was a field secretary for the Student Nonviolent Coordinating Committee, SNCC, and I did a lot of work in Mississippi that fundamentally depended, as a community organizer, on getting churches engaged in the struggle. All you had to do was sort of invoke the name of Dr. King, and all of a sudden you had a lot of people saying, okay, we're with you. That in the 21st century, the church and its capacity to stigmatize a lot of our efforts around this epidemic is creating this set of problems that I sort of alluded to. It leads me to believe that of all the things that we could do without relying on federal grants and without relying on large infusions of soft money, one thing that we can do to change community thinking around, specifically with respect to stigma, would be go to the source and say, we have got to change.
Questions? Yes, sir.
Hi.
My follow-up question. To what extent is the in this business to what extent is the WHO accepting or money, directly or indirectly, from businesses? Is that a part of this public-private partnership that is happening?
WHO is facing some tough questions this morning. It's not what's happening. I mean, what I would say is that we have just established what we call a South-to-South forum, which is addressing the issue of public-private partnerships, and we're just at the very beginning of that, trying to establish, the criteria and the terms of references in terms of the collaboration. But certainly, no, it should not be about accepting funds.
Is it though?
Please give this panel a round of applause. I know that some of you are shy and asking questions. I'm sure that if you email them with your questions, they will respond to you. One of the unique things that we have found in terms of the individuals that we have invited to participate in this workshop over the years is their engagement after the workshop with regards to questions that they get, and sometimes establishing relationships, especially with students, in mentoring roles, in opportunities that they may have not known existed, where they can engage and continue their work or even launch new careers. And so please do, if you have a question that you weren't able to ask any of the